Sir, I'll give you a cue of 3, 2, 1, and then you can start. Okay?
Yes, please.
Okay. 3, 2. First, you can start with your introduction and then carry it forward with the entire script. Yeah? 3,
Yeah.
2, 1, start.
Hi, I'm Dr. Yalamanchi Sadasivarao, the practicing diabetologist and the senior most diabetologist in the state of Andhra Pradesh from Yalamanchi Diabetes Specialty Center, welcoming you all to the 17th episode of Diabetes Prime, a weekly news roundup on diabetes. The objective of this weekly show is to keep all of us updated with the latest in diabetes, advancements in diabetes from across the globe, which will help us to provide better and latest evidence based treatments to our patients and to help them live well with diabetes. As all of you are aware, that lifestyle modifications, diet and lifestyle modifications play an important role in the management of diabetes, and exercise controls blood glucose levels, and other cardiometabolic risk factors. In this episode, we will talk about a critical study that assesses the impact of exercise training on inflammatory and cardiometabolic biomarkers. Other latest updates covered in this episode include the increased risk of type 2 diabetes in late chronotypes that is related to circadian rhythms, ultra fast acting Lispro, which improves the postprandial glucose in type 2 diabetes, the ADA EST consensus on the importance of language in diabetes communication between the patient and the healthcare providers, an advanced hybrid closed loop system in adolescents and adults with type 1 diabetes. We'll start with the first one, the night owls at an increased risk of type 2 diabetes. That means a lot number of studies are there suggesting that circadian rhythms do play a very important role in our life, and that's why they're saying that early to bed and early to rise makes Jack a good boy. That still holds good. So synonym. And so people who are early birds who prefer to wake up early and or perform activity earlier in the day depend more on the fat as an energy source and are more active during the day with increased levels of aerobic fitness than night owls, those who stay up late in the owl. So night owls, those who stay up late in the night. So actually, people who are working during night shifts are more at danger. And so there is also a study showing that in nurses that they who are doing night shifts, they're having insulin resistance is more in them, and they're more prone to have high, not only high blood sugars, but also they can get diabetes early. So in a study that used advanced imaging to assess body mass and body composition, the insulin sensitivity, and the breath samples to measure fat and carbohydrate metabolism. So, the researchers in the study reported that early birds use more fat for energy at rest and during exercise than night owls, and so early birds are more insulin sensitive. That's why we ask our patients to eat early by 7:30 p.m. and to go to bed by 10 or 9. It's possible. So, so again, another study showed that which is tried to assess if the resting and or excess fuel use differs in early versus the late chronotypes as it relates to insulin sensitivity. The main findings showed that early chronotypes with metabolic syndrome utilize more fat during rest and exercise, independent of aerobic fitness, compared to late chronotypes or you can say late sleepers. Early chronotypes are were also more physically active throughout the day
Uh,
and greater
sir,
fat.
sir, so sorry to interrupt. So actually, can you just repeat the last 2 minutes part?
Sure.
Yeah. And sir, if you can look in the front, it will be really great actually.
Yeah.
Yeah. Okay, sir. You can just start in three, two, one, and you can start.
Okay. So the study tried to assess if the resting and or exercise fuel use differs in early versus the late chronotypes as it relates to insulin sensitivity. So, just as I have stated, that people who get up early in the morning are called as the early birds, and those who stay during the night or work late are called as the night owls. Owl means you know that it's a bird who stays during the night. So, and actually now most of these people who work in the IT, they're working in night shifts, and they're more prone for insulin resistance, and they can have diabetes early. So I think we have to be very careful in order and to try to maintain the circadian rhythms, which is very important. That's what the study shows that, and the main finding showed that the early chronotypes with metabolic syndrome utilize more fat during rest and exercise, independent of aerobic fitness, compared to late chronotypes. Early chronotypes were also more physically active throughout the day, and great fat use was linked to non-oxidative glucose disposal. Again, the findings suggest that early chronotypes have differences in fuel selection that are associated with risk of type 2 diabetes. Next slide, please. What do you see? Okay. Now we'll go on to see that how postprandial blood sugars, all of you are aware, or we know that the postprandial blood sugars or glucose spikes can cause an increase in the cardiovascular risk or cardiovascular disease in diabetes. So, a multinational, multi-center, randomized double-blind treat to target 26-week phase 3 trial was conducted to assess the efficacy and safety of ultra-rapid acting Lispro in adults with type 2 diabetes. Ultra rapid acting Lispro is a new formulation of insulin Lispro which aims to match the physiological insulin response more closely to meals to improve the postprandial glucose control. The study again concluded that ultra rapid acting Lispro in a basal bolus regimen showed superior control of postprandial glucose and was non-inferior and there was non-inferior A1C reduction compared with the insulin Lispro. So fast-acting insulin Lispro was actually when compared with the normal Lispro, there was it was non-inferior in A1C reduction, but it was able to show a superior control of postprandial glucose. Again, the safety profile is also comparable with the insulin Respro in adult patients with type 2 diabetes. The postprandial glucose levels have a strong correlation with cardiovascular events than A1C levels. Hence, it is important to target postprandial glucose. However, bolus insulins have not been adequate in matching carbohydrate absorption, which influence their efficacy and dosing flexibility. In this contest, the ultra rapid acting insulin Lispro is specifically designed to match the physiological insulin response more closely to a meal to improve the postprandial glucose control. Next slide, please. The ADA ESD consensus statement says that communication with the patient and the health providers, language does matter in the communication between the patient and the healthcare providers. The communication between people living with type 2 diabetes and healthcare team members is at the heart of the integrated care, and a clinician must recognize how language matters. Language in diabetes care should be neutral, free of stigma, and based on facts. Language should be strength based, respectful, and inclusive. Encourage collaboration, and it should be person centered. People living with diabetes should not be referred to as diabetics or described as non complaint or blamed for their health conditions. So the diabetic, the word diabetic has been replaced with people with diabetes. So a few practical tips is acknowledge the lifelong and evolving nature of type 2 diabetes, identify and coordinate with the team, know your local resources, and language matters in diabetes care. Health practices and systems must establish enhanced communication technology to improve engagements with the patients. Next slide, please. The effect of exercise training on inflammatory and cardiometabolic risk biomarkers in patients with type 2 diabetes. The interaction between type 2 diabetes and cardiometabolic morbidity and mortality arises from the progressive inflammation underlying both diseases. Exercise training is known to be an effective treatment strategy for type 2 diabetes and cardiometabolic disease. If you look at the uh, methods they used in the clinical trial, it's a randomized controlled trial with search using electronic database from inception to January 2022. Random effects models were used to assess weighted mean difference with 95% confidence intervals. The study selected 25 RCTs that were included with a moderate to good overall methodological quality. And if you look at the results, the meta-analysis showed that exercise training significantly increased adiponectin and reduced fasting insulin. Hemostatic model assessment for insulin resistance, tumor necrosis factor, alpha, interleukin 6, and C reactive protein. The subgroup analysis by training type indicated that aerobic exercise had the most consistent beneficial effects compared to other types of exercise training. And finally, the study concluded that different types of exercise training increases adiponectin levels and reduces the flow of inflammatory cytokines such as tumor necrosis alpha, IL 6, CRP, as well as fasting insulin and insulin resistant markers in patients with type 2 diabetes. However, these effects were not beneficial for more frequently measured cardiometabolic risk factors. Next slide, please. So next we look at the advanced hybrid closed loop systems in adolescents and in adults with diabetes. So study revealed that an advanced hybrid closed loop system enables the safe attainment of recommended glycemic targets in people with type 1 diabetes after 6 months of usage. The study it evaluated the effectiveness and safety of the closed loop system in people with type 1 diabetes earlier treated with CGMS or continuous subcutaneous insulin infusion combined with flash glucose monitoring in a real life setting. So the results showed that time in range was in between 70 to 80 milligrams per deciliter, and it increased to from 65.3% at baseline to 73.8% at 6 months. So time in hyperglycemia was more than 180 milligrams, which decreased from 26.6 to 19.3%. So time in hyperglycemia, that is 70 milligrams per deciliter, decreased from 4.6 to 2.3%. No episodes of severe hypoglycemia, diabetic ketoacidosis, or diabetes-related hospital admission occurred. The advanced hybrid closed-loop system is the latest generation of automated insulin delivery system for use in people living with type 1 diabetes. It has several advanced features such as auto basal and auto correction. Next slide, please.
In a standing position so that you can read it in a better way, because what happens is when you're talking, it should look that you're talking to the audience. So it's important that you maintain the eye contact with the camera.
Sure, sure, please.
Okay, sir. Yeah.
You want me to repeat it? It's over.
Sorry, sir.
You want to repeat it? I finished the.
Pratik, can you just check? Do we need to repeat the entire thing, or we can continue further?
It's over.
So you can just continue from just last 1 minute. Last 1 minute. Yeah. And sir, if you can
Pratik?
keep the script in front of the screen. So, yeah. So it will be look like you are looking at the audience, talking to the audience.
Yeah, I'll start with the last one.
Yes, sir. You
Yes,
can
sir.
just start. Yes, yeah, you can start.
So we will discuss about the advanced hybrid closed loop system in adolescents and adults with type 2 diabetes. So a study revealed that an advanced hybrid closed loop system enables the safe attainment of recommended glycemic targets in people with type 1 diabetes after 6 months of usage. And it evaluated the effectiveness and safety of the closed loop system in people with type 1 diabetes earlier treated with continuous subcutaneous insulin infusion combined with flash glucose monitoring in a real life setting, that is CGMS. The results showed that time in range was in between 70 to 80 milligrams per deciliter, increased from 65.3% at baseline to 73.8% at 6 months. That means that the time in range actually increased with the closed loop system, and time in hyperglycemia more than 180 milligrams decreased from 26.6% to 19.3%. Time in hypoglycemia 70 milligrams decreased from 4.6 to 2.3%. So time in range, time in hyperglycemia, and time in hypoglycemia have shown a considerable improvement with the hybrid systems, and no episodes of severe hypoglycemia, diabetic ketoacidosis, or diabetes related hospital admissions occurred. The advanced hybrid closed loop system is the latest generation automated insulin delivery system for use in people with type 1 diabetes, and it has several advanced features such as auto basal and auto correction, which would benefit the patients in their day to day management. Thank you.
Sir,
Yeah,
Yes, sir. Am I audible now?
yeah, yeah. Is it a live or
Yeah.
recorded?
So this is a recorded session, but the host had put us on the backstage, so that's the reason I could not respond to you.
Okay, thank you.
Yeah. So, sir, you may continue.
It's over.
Yeah. Okay, sir. Then, thank you so much. So, what we'll do is we'll edit the video, and we'll send it for your approval. Once you approve it, then we will. So this will be published this Saturday at 9 p.m.
Thank you. Thank you very much.
So, okay. Thank you so much, sir.
bye.